Unit prep skill evaluation. Before the skill eval, obtain the isolation gown, the hair covering, eyewear for the patient and the clinician, bib clips, and writing utensils, and place them all in the back cabinet. Perform your hand wash. Don your hair covering, isolation gown, and mask. Make sure that you tie securely in the back, up at the top, and then you'll also bring the straps around from the front and tie them in the back. Once your mask is on, we're going to go and retrieve the utility gloves. And we're also going to retrieve your soapy and disinfectant wipes and set everything on the counter. Disinfect the utility glove with the disinfectant wipe. And then we are going to use the soapy wipes to clean the eyewear for the patient and the clinician. If they're saturated, like these appear to be, squeeze out the excess liquid before you start with the cleaning. This would be for the eyewear, and this also would be the same time where if you wore prescription glasses, that you could go ahead and put your side shields on. Now, since the utility gloves are already disinfected, you may place your safety eyewear and your face shield on if you were using your face shield the same day. So with disinfecting wipes, you want to pre-clean all the countertops. So include the sink, counter, and the sink and the faucet itself. In the back counter, you can just go ahead and disinfect the things that are on top of there as well while you're at it. After all the countertops, then we can go ahead and start with the front delivery system, including the entire length of the arms and hoses. The touchpad also. Notice how when she's cleaning the hose, she's going all the way from one end to the other and cleaning out the cradle that they sit in as well. Then we would go ahead and do the water bottle, and the computer monitor and keyboard handles. Next would be the assisting arm and hoses. And it's the same thing on this side here, the entire length of the hoses and the cradle that they sit in. We also need to disinfect the base of the patient chair and the rheostat. And this is when you can just pull the rheostat out from underneath the chair and it'll stay there while you're utilizing it. So you'll need to get rid of the wipes and obtain new ones anytime they tend to be dried out, or if they look like they're just accumulating a lot of debris, like usually on those lower portions there they do. So you want to get nice fresh wipes when they dry out or if they look visibly soiled. So discard them and obtain others as you need it. Alright, so next we would go ahead and wipe all the cabinet drawer handles and the door handles. While she's finishing up with those, I want to mention that with the disinfectant, be sure and read the manufacturer's instructions. With most of them, they have to sit for anywhere from 1 to 3 minutes. The particular one we have now is for 3 minutes. So once everything is done, do not start to re-wipe again until that time has passed. For the sake of our skill evaluation, we're not going to go through everything again, but just remember you're going to wait the amount of time that the manufacturer says, which was 3 minutes for us, and then you would go ahead and wipe again. Remember the wipe, discard, wipe. Okay? We're not doing it just because we're trying to save time with the video. Next thing would be the soapy wipes. With the soapy wipes, we're going to wipe all surfaces of the operator chair, including the legs. And we're going to wipe all surfaces of the patient chair, including the headrest. And the armrests. And once the chair is done, that's when we go ahead and wipe only the face of the unit light. Next, we would disinfect the utility gloves. And the canisters of the soapy wipes and the disinfectant wipes. Place everything underneath the sink, making sure that the lids are all closed securely. Next, you will perform your hand wash and remove the clinician eyewear and gown. Make sure that you place your gloves on the hook. with your mask on. Next, what we always need to do is make sure that we have water in the water bottle. So we're going to check the water level, and we only fill it if it's empty. If it's empty, we would turn the unit off, lift and twist the bottle and fill with tap water, and put a tablet in. We'll show you more how to do this during pre-clinic because there is enough water in there now. We're going to obtain the necessary barriers, which are usually all in this red bag that you see right here, and the barrier tape. With the barrier tape, we're going to put 3 of them on the operator chair on the handles that we use to adjust it. Make sure that they're on there securely. We're going to put another one on, 2 of them on the monitor handles. You'll only be touching these with your gloves on once those are covered. And then another one on the overhead light button. Next, we're going to put a tray sleeve on the instrument tray. It's a small one. And we're going to put a chair sleeve on the patient's chair. For the front delivery system, we're going to actually tear the bag in half. You find one of the seams, it usually tears pretty easily. I'm going to place that over the front delivery system. Going to use a half chair cover for the assistant arm. And with both the assistant arm and the front delivery system, the only hand pieces that you would put back into the, or the connectors that you would put back into the cradle are the ones that you're going to be using for the day. Everything else would stay covered. All right, and then we are also going to use a half chair cover on the keyboard and mouse. And again, we're going to split the chair in half. Excuse me, split the bag in half. And then another one on the operator chair. We're going to use sleeves on the air water syringe on the front delivery system. the ejector. And I want to say too that this is really your preference. Whichever one of those air water syringes that you feel comfortable using, you just put the sleeve on that one. Some students prefer to use it all off the assisting arm, others like it on the front delivery. So that's really up to you, as long as whatever you're using is covered. And then both of the light handles. Next, we're going to place the waste bag on the side of the front delivery tray or the instrument tray. And again, notice how everything for the patient care is on this back counter here. As far as your notebook or things you're not going to be using directly with the patient, that will be in the cabinet or put away securely and only take it out as needed. The notebooks will be collected at the end of clinic.